Hi, everyone. I'm so glad that you could join us. My name is Meredith Farmer, and I am an assistant clinical professor and also the interim program director of the Neonatal Nurse Practitioner program. And I'm here to go over what you can kind of expect in the NMP program at Emory University, as well as what an NMP is, what our role is, and what we do. Okay. Okay. So first, I'm just going to talk a little bit about the overview of the NMP role, and then the training at Emory, and then definitely have some time for questions. If anyone has any questions for me, I would love to answer those. Okay, so what is a neonatal nurse practitioner? We are advanced practice registered nurses who specialize in the care of high risk newborns, including preterm and full term infants. So that can include a variety of different roles for us. We are able to take care of patients up to the age of 2. So that can include, the acute care neonatal ICU setting, where it can also go to outpatient settings with community practices and pediatricians' offices as well. It is an advanced degree, so you would have a master's of science in nursing or a doctorate of nursing practice. At Emory, we currently only offer the master's of science. It might change in the future, but that's all we have right now. And then there is a caveat to all advanced practice degrees where we're licensed by the state, like we are with our registered nursing license, but then we have a national certification, and that's offered through the National Certification Corporation that we're board certified through. Um, and that's something that we attest that you will take after graduation. There is not a state by state required testing. So, our scope of practice. So, our main area of responsibilities, we do manage the care of acute and chronic conditions in neonates. This, includes preterm babies that are born at as low as 22 weeks in gestational age, along with not just the premature infants, but the term infants that are born who are critically ill when they're born with respiratory distress, different congenital defects, along with like heart diseases and things like that. So some of the things that we do collaborate with neonatologists who basically they have their specialty, they're pediatricians with this specialized training in neonatology. And we also are a part of a multidisciplinary team of nurses, physical therapy, occupational therapy, speech therapy, um, neonatal pharmacists, dietitians, and we use all of the different disciplines, and we are the ones who kind of hold it all together and manage the baby as a whole, where they might manage specific aspects of the patient's care. We also prescribe medications and treatments, along with ordering and interpreting different diagnostic testing, um, along with neonatology, of course. So the different kind of settings we can work in the neonatal intensive care unit. We can work in step down units, which is more like a level 2 NICU that might have later preterm babies between 32 and 36 weeks gestation who need help just with their feedings or with their thermoregulation. We also can work in the delivery room. We attend all high risk deliveries, depending on which facility you work in. We can be on transport teams where we manage the care of a neonate during transport. And then we can also work in outpatient clinics. And this is a variety of different clinics that we can work in. We can work in like developmental care clinics of patients who were in the NICU and who need specialized care after they get out of the NICU. We can work in primary care pediatric office doing well baby exams. We can work in well baby in the well baby unit on mother baby and just see well babies. So we really do have a great variety of different settings that we can work in. And so then I just wanted to talk, this kind of goes along with the settings that we work in, but the type of jobs that we have as NMPs are clinical roles, NICU-based NMPs. So we work in those level 1, 2, and 3 NICUs and level 4 NICUs where we take care of surgical patients. We can work on transport as an NMP, delivery rooms, outpatient follow-up clinics, and then what this slide really wants to show is we are able to work in clinical roles, but we also have that option to work in non-clinical roles. And that's what's really exciting to me is the variety of different settings that we can work in and what we can do to impact the field of neonatology, not just one, patient at a time, but on the broader scale. So you can work as, educators or faculty at universities in more of a education role. You can also do research. You can do research in the university setting, or you can do research in the hospital-based setting. And this is just, with your master's degree too, you don't necessarily have to, go full force through for a PhD to do research if that's what you're interested in later on. And then also just the leadership administration and administrative roles that you can take as head of NMP groups or even higher up in facilities if you're interested in that. Okay, and then our job duties. So our essential primary job functions includes the initial stabilization and resuscitation of neonates after birth. We also will develop and implement a plan of care for that patient, and that's a medical plan of care. So we are, deeply involved with that when we're working in the NICU setting. Then we have the family education and support. Like I said earlier, our job is we take care of the whole patient. That includes the family. So we're able to work, closely with families. And what makes us different from other acute care or ICU settings is we don't only have our patient for, 2 to 3 days until they're moved down to a step down unit. We have those patients from birth until discharge that can be anywhere from a week to 2 weeks up to 6 months to sometimes a year. So we are really integrated in with that family and want to make sure that the family has the different things that they need for their outpatient resources and the education that they need to adequately be able to take care of a critically ill patient. We monitor the patient's growth, development, and their outcomes. And that can be done from a research standpoint as well if you want to implement any quality improvement projects. And then from a more of the acute care, fun side of it, the different procedures we get to do. We will do intubations, we do umbilical venous or arterial lines, we do peripheral arterial lines, lumbar punctures, chest tube insertion, thoracentesis, anything that the baby needs to make the baby better to prevent a problem, we are able to do that inside the NICU. We also have a very autonomous role and where we're able to care for those infants on our own using our knowledge on how to care for the babies when we're on call overnight. Okay, so I want to talk a little bit about Emory's NMP program. First of all, the master's program is the #1 program in the country. So that's really exciting. We have a lot of great resources at Emory that you might not have necessarily see in other places. One of the biggest things I think from a acute care standpoint from our program, because we are an acute care specialty, is the ability for us to have high fidelity simulation in our beautiful Emory simulation center. And I, make sure that we take as full of advantage as we can of that simulation center while we are on site intensives. Okay, so our overview is we want to train the next generation of neonatal nurse practitioners. It is a combination of online coursework and in-person intensives. So what that means is usually 1 to 2 times a semester, we do meet on site for 2 to 3 days. And we have it's a very rigorous, busy time, but it is such a great time for us to collaborate together and to be able to network and meet each other. We usually try to do some sort of team building exercise while we're at intensives at night, go out to dinner together. This past cohort, we did glass blowing one night. And so we try to do things besides work to kind of break up the monotony of being in the simulation lab as well. All of the didactic content is available online. We do have some synchronous sessions throughout the course. But you will know about those months in advance. And I try to really individualize that to each cohort on what time we do them at and what day of the week to make it, most manageable for everyone. So it's not something you have to worry about. I'm going to pop up on you, a week ahead of time that you need to, make sure that you're on Zoom at a specific time every week. And we're usually only online together for about an hour to an hour and a half at the most. So we do the didactic online coursework. All of your material is on our learning management system, which is Canvas. We will have in-person intensives, and those will vary between semesters. Either once to twice a semester we'll meet for a couple of days, and you'll also know about those. I'm planning dates for fall of next year, so you'll know about those dates well in advance of time so you can plan accordingly. And then we just are fully accredited by the CCNE. So for clinical rotations, what we do with our students is we help find clinical placement sites in collaboration with the student. So while we don't fully place a student, we will help you find placements, especially if you don't have as much experience, in the NICU where you have a lot of contacts of places that you can go. We do have clinical sites we use. Some of these include Emory University Hospital Midtown, Choa Eggleston, other partnering hospitals in the Atlanta area. We also have clinical partnerships with several organizations in different states as well. We have a few in Florida and North and South Carolina. And then we have some in California. So we really are trying to broaden our clinical sites to best fit the student's need. And then if you have a personal site that you would like to use, you're more than welcome to bring that to us, and we will do what we can to get you a contract with that facility. We do allow students to do clinicals at their facility that they currently work in, as long as it's a level 3 or a level 4 NICU. The only caveat to that would be I would prefer you not do all of your clinicals in the same facility, because there's a million different ways to practice in neonatology, and I want you to see more than one way to do things. I want you to know that there's different processes and there's different way to care for babies and get the same outcomes. And so then you can decide for yourself what your clinical practice will look like. So our focus on on the rotations, this is going to include your hands-on neonatal care, delivery room, stabilization, and management of the critically ill newborn. And what we do is we start the clinical rotation in the spring semester. You have 3 semesters of clinical, and they progressively increase in clinical hours as you go. The first semester, we really like for the students to do more level 2 type NICU care. So you're taking care of those late preterm babies. You're taking care of the sepsis screening, mild respiratory distress. And as you move through your clinical rotations, we want you to progressively start taking more acute patients. And this can be individualized on what you need, what you've been able to see so far in clinical, so you can get as broad of an experience as possible. And then the different settings that our clinical sites are, we definitely want to have, they're in the neonatal intensive care unit. We'll use some step down units, especially for that first semester of clinical placement. So you can get more of the late preterm care, delivery rooms, and then surgical experience in children's hospitals. So all of the faculty members at Emory, they are practicing NMPs. I personally continue to practice clinically locally in Marietta, Georgia, at 2 of the local community-based hospitals. And I also do locums work, which is considered travel nursing, in several different states, which I love. I love seeing the way different things can be done and meeting different people. So that's something that's really exciting for me to be able to do. I do want to always make sure that I, support an inclusive and supportive learning environment. There will be the ability to have one-on-one mentorships with faculty and previous graduates from our program. So if that's something you're interested in, I would love to get you set up with someone who's recently graduated from the program, so you have someone to talk to that's not necessarily your faculty members. And then the intensives, this is such a great networking opportunity for us. I immensely love being on site with everyone, but also understand that it's really important for people to have online education. I would not have been able to go back to school if I did not have online education. So I make sure that the times that we are at intensives on site, I make sure that these times they're well used and we're not just sitting around. We're getting, you're getting time in our simulation lab, resuscitating our mannequins. We're working on procedures and skills, and that we're really utilizing that time well together. So, how to apply our admission requirements. You need to have your bachelor's of science in nursing or your master's in nursing. There is a minimum GPA of, I believe it's a 3.0, and then you do need RN experience. So, a little bit about the RN experience. You do not have to have 2 years before applying for the program. You need to have 2 years or very close to the 2 years before you start your clinical. If you are a newer graduate and do not have all that clinical experience yet, that's okay. You can go ahead and reach out to me and we can talk, because there are specialized plans of study where we're able to, slow your plan of study down. So you're getting that time in the NICU and you're also working towards your advanced practice degree. So don't necessarily completely say, I'm not going to do this because I have to have 2 years of experience before I apply. That is not the truth. And so just always make sure you come to me and we can talk about it and see what the best course of action for you is. You'll also need to submit a personal statement and CV along with some letters of recommendation. And we're just kind of an evolving application process. So anytime you are ready to put an application in, go ahead. And everything is listed on our website for that as well. Okay, I'm going to stop sharing. And does anyone have any questions for me that I didn't go over? Anyone?
I think that means you did a great job of covering that.
Yeah.
I'm gonna drop that website right in here if anybody does have questions about the application process. This is the website that you'll need to go to. Also listed on there is the curriculum plan for both full-time and part-time options. If you want to go down there and see exactly what the curriculum looks like per semester, and what the clinicals look like that go along with that.
And I also just put my email address in the chat for you as well. You are always more than welcome to reach out to me. I try to get back as soon as possible. Also, my email is, or my cell phone number is listed in my email signature. If you need to text me, call me, you're always more than welcome to, and I'll respond as soon as I can.
All right, any last questions before we end this session?
So I do have a quick question, and I think I might be very unique in this question. So if the other two want to leave early, I'm not sure it would necessarily have anything to do with them because I'm in the MN to MSN or MN to DNP program. And originally we were told that we were not able to do this program because
Right.
you need the experience. However, we had somebody come and talk to us a few days ago, and she said that the neonatology program is the only acute care one that is on board for us, as long as we have those clinical hours working as an RN by the time we sit for boards. So I don't know what that means based off of the application and what it looks like on the website, but I did confirm with her multiple times.
Yeah,
So,
so this is something new that we are starting.
okay.
And I think this is easily to be able to be addressed on the recording and everything.
Okay,
So
great.
yeah, so we are starting an MN pathway program where in your last two, and we're right now we're trying to, gauge interest in this. And so there's actually going to be a lunch and learn on November 12th, um, after it during your lunch hour. So from
Okay,
20
Perfect.
o'clock. We're going to have a lunch and learn about it as well. I'm basically going to go over the same information I just went over though, but
Okay.
more to the MN pathway.
I
So,
think a lot of people, at least a lot of people that I've talked to, seem relatively interested in that. And it was a big, exciting thing when we found this out a couple of
oh,
days
that
ago.
that makes me so happy because I love my job and I love my babies, and we're definitely a field that is in growing need. And we are across the country. There are, around 1,000 positions open right now from me personally looking and trying to
Yeah.
count. And we're across the nation, we're only graduating about 300 to 350 people a year.
Oh,
Um,
that's wow.
yeah, and a lot of our workforce is retiring, aging out. So to have, the younger generation interested in it is super exciting for me. So for the MN pathway students, what this is going to be is we are going to offer two elective courses in the last 2 semesters of the program. And it's going to be basically like a neonatal 1 and a neonatal 2. So
Okay.
those courses will take place of some of your clinical experience needed before you start that you would need before you start clinical. So you'll learn, neonatal resuscitation. You'll learn basic neonatal care that you would normally do as a bedside nurse, that you would learn as a bedside nurse. So that's the first part of it. And then we would encourage you to try to get a job as a tech, if possible, in a NICU. And we're going to do everything we can to also offer you your preceptorship. I'm not sure what you call it, but your last semester of clinical hours where you
Yes.
kind of pick your specialty. We're
I
going to,
wanted to pick neonatology. I've kind of
yeah.
done that since the beginning, and I do want to end up being a tech. I know I did not do it with the externships this semester because CHOA was completely off the table, and
Right.
so they weren't doing any techs with Emory, at least for the time being, but that's for the externship. So I don't know about actually looking into being a tech and getting
Yeah,
that
well, an internship
experience.
would work as well. There's another facility that I know hires externs in the NICU that I can, if you want to email me about, I can tell you about them because I have
Absolutely.
connections there.
Okay, great.
Yeah.
Fantastic.
So you would do the two electives in your last 2 semesters of the program. So basically, we'd be starting the electives next semester. So it would be for
Yes.
spring and summer. You would take this elective. I'm
Mhm.
not. I'll more than likely be the one teaching the course. I am the one currently writing the content for the course. So I'm not going to make it super heavy load because I know that you guys are super busy with your program. But I just want you to get that experience of, because I don't want people coming into NMP and not understanding what it is and what we do.
Absolutely.
I want to make sure that you understand that this is an acute care, and I'm going to be very open about how our job works and everything throughout these electives. So
Okay.
if you choose it's not for you, that's fine. You'll have an informed decision. And then you would do your preceptorship. And then so you would start taking some of your I want to call them basic in MSN courses, but that I know that's not really the right word for it, but your core courses that everyone has to take, advanced pathophysiology,
Yeah.
the lifespan. You would start taking those courses in the fall after graduation, and you would be at a part-time plan of study. And during that time, you would be sitting for NCLEX, and you would be taking, and then you would be finding your job as a neonatal nurse, which is not difficult to find. So and that at that point, you would go into the NICU and you would start getting your working experience with knowing that the 2 semesters of electives that you've had that will have some simulation hours with them is making up for some of that experience, because
Mhm.
NCC, they only require you to have 2 years before you sit for boards. It's our professional organization, which is NAN, that their recommendation is that people have 2 years before they start clinical. So we're
Correct.
going to
Okay.
use some of the elective hours and simulation hours in the sim lab to make up some of that um, clinical clinical hour time.
Okay, perfect. Thank you so
Yeah.
much for explaining that and that whole debacle there.
You're right, right. And like I said, I would love to meet. If you want to email me, go ahead about the other. And
Perfect.
like I said, I'll be there on November 12th as well. to meet with
Okay,
everyone.
great. Yeah, I will definitely go ahead and shoot you an email and possibly see about starting off as just doing some tech work in a NICU somewhere around here.
Yeah, perfect.
Awesome. Thank you so much. I really appreciate it, Meredith.
Welcome. I'm excited.
And Macy, I think you should have actually gotten an invite to that NNP luncheon. If you have not, I'm going to go check to make sure. If you have not, I'll send it your way as well.
Okay, I have not gotten an invite to that, but it's very possible. Actually, I really don't think so. It might not even be in my junk. I'm usually really good about my emails.
Yeah, I'll
Um,
go through and just send it to you again.
that would be great. Thank you so much.
Mhm. All right.
Any
Any other questions?
Hey, I have a question. Mine kind of piggybacks off of the RN experience as well.
Sure.
My name is Cherish. I've been a NICU nurse for about 7 years now, and I've been looking at this program for like a year and a half, but the RN experience was the thing that was holding me up because my primary hospital is a level 2, and this last year, the very beginning of this last year, we transitioned to a level 3. So we're still in like the growth stage of transitioning from a 2 to a 3.
Right.
Um, but for 2 years while I've been working here, we had a rotation plan where the nurses on staff would go and work at a sister hospital that was a level 3.
Hmm.
So that's kind of held me up in applying because of the RN experience for 2 years. So I'm kind of wondering if I need to wait that out a little longer or if we think that that's going to be okay.
So yeah, so how big is your level two?
It's 12 beds.
Okay. Are you local?
Yeah, it's in Covington, Piedmont Newton.
Oh, okay, okay. So yeah, I think that so y'all are a level three now. I think that you could go ahead and apply because if you wanted and if you wanted to start in the spring, you
Hmm.
could take some of your and kind of do the part-time. I really don't recommend people going full-time in our program just because
Hmm.
it's a lot and I really want you to continue to work to gain that experience as well. And who can quit their job once they're already a professional, to go back to school.
Yeah.
So if you started like in the spring, you could do like your advanced patho and some of those courses and get those out of the way. So you could then start in like the fall of 25 cohort
Hmm.
and wouldn't start clinical until spring of 25.
Okay.
So a year, basically a year from January. So there's your experience right there.
Right. Okay. Okay.
Yeah, I think that would be great.
Okay. Thank you.
You're welcome. Do you have anything else?
Awesome. Well, thanks so much for joining us. Thank you so much, Dr. Farmer, for all the information. This will be recorded and put on our YouTube page for if you need to go back and listen to any of it. And again, we appreciate you being here. Thanks so much.
Yes, thank you so much, guys. I look forward to hearing from you.